Hi everyone, I'm Thashreefa Sherif, consultant psychologist, Asha Hospital, Hyderabad. Dementia is not just a medical condition, it affects the entire families and community. Unfortunately, there are a lot of myths and misconceptions about dementia which prevent people from seeking timely help and provide right support. September month is observed as World Alzheimer's Month in order to create awareness about dementia and help people who lives with it. So today we have Dr. Saqib. She is a consultant psychiatrist at Asha Hospital and an expert in dementia care. She will help us shed some light on the myths and misconceptions about dementia and help us to know dementia better. Hi ma'am.
Hi.
So ma'am, before going to myths and misconceptions about dementia, can you just walk us through what dementia is?
Thank you, Thashreefa. Yes, it is very important to first understand what is dementia. Dementia is generally an umbrella term which is used to describe a group of symptoms, a term used to describe a disease related to our brain, okay, which involves mainly our memory, loss of memory or impairment in memory. Also, along with memory impairment, we can observe impairment in other cognitive functions such as attention, concentration, language, communication, and decision making capacity, and also some personality and behavioral changes. It is a progressive disease in nature. That means, as the age and time advances, the disease also progresses. So, the timely diagnosis and intervention is very important in dementia.
Okay, ma'am. Thank you for this very clear definition about dementia. So, moving on to the first myth that we have today is that dementia is just like normal aging and there is no difference in that. Can you explain it?
Yes, it is a very common myth that dementia is just normal part of aging. No, it is not like that. Aging can usually slow down a person. With age, sometimes a functionality of a person can become slow. But not every person who is old or more than 60, 70 years of age will develop dementia. Dementia is a disease which is associated with particular risk factors and it is associated with it involves changes in your brain, and secondary to those changes there are impairment in memory and cognitive functions. So the normal aging and dementia both are totally different.
Next one is, ma'am. So, is it like only old people get dementia, or is there any other category of people that we should fear that they could also have dementia?
Yes, another important myth that only old people can develop this disease or dementia. Yes, it is very commonly observed in people who are old, that is more than 60 or 65 years of age. But sometimes dementia can be observed or the onset of dementia can be at a very younger age. For example, some of the dementias like frontotemporal dementia or familial Alzheimer's diseases, they do manifest or they start manifesting at very early age.
Okay. So, ma'am, you also mentioned that dementia is a progressive one, right? So, if it is a progressive one, is there any, benefit that we are getting if we do the diagnosis and the treatment and everything?
Yes, many a times people say that, oh, the person has developed dementia and memory loss. What is the point in diagnosing and what is the point in treating? It is going to advance anyways. Yes, I understand that dementia is a progressive neurodegenerative condition. The problems are going to increase further and further as the disease will advance and disease age will progress. But it is not that there is no point in diagnosis. The earlier we are able to diagnose, the earlier we are able to manage the disease in a better way. Early diagnosis and detection of dementia makes a lot of difference. There are ways to manage dementia with the help of treatment, with the help of therapy, and by this we can make a person's life and a family member who's caring for dementia, their life a lot better with care and comfort.
Okay, this is so good to hear because a lot of people are still struggling because they don't know what to do next with their parents or their partners who have diagnosed with dementia. because of the society telling them that there is no point in giving treatment to them or taking them to hospital. So this will be a very good response or information for them.
Besides Tashrifa, not all memory losses are dementia. So we need to sometime diagnose to see whether a particular memory loss is reversible or not reversible. Because sometimes memory impairment or memory loss could be because of some of the reversible etiologies. For example, nutritional deficiencies, vitamin B12, vitamin D3 deficiencies, thyroid insufficiency, or it could be simply because a person is having a lot of anxiety, or a person is suffering from depression, or sometimes in patients can have increased intracranial pressure, which is a condition called as normal pressure hydrocephalus. So these are the conditions where memory impairment is reversible to a lot extent. If we are able to diagnose on time, if we are able to treat on time, then the memory impairment can be reversible.
Okay, doctor. So now you are telling that memory impairment can mimic a lot of things other than dementia also. So it is very much needed to be diagnosed and treated by a professional, right? Since we have talked a lot of about memory loss, can you just tell us or explain us, is there any other symptoms other than memory loss and dementia?
Yes, memory loss is one of the commonly observed symptom in dementia, but as I told, in dementia, there are other symptoms such as impairment in attention, concentration, impairment in new learning, okay, registering new things and recollecting them, or storing a new information as memory. Then there could be impairment in the way they talk, they communicate, the language could be affected, they're not able to speak as they used to speak earlier. Then there could be problems with their decision making capacity, how they are behaving in a social situation. There could be a lot of behavioral and psychological symptoms also, such as anxiety, agitation, irritability, sleep disturbances, eating behaviors. So these are also commonly observed in dementia.
Okay. And there is another common misconception that all the dementia patients or a person with dementia is aggressive or violent. So, can you help us understand why?
Yes, it is very commonly observed that a person suffering from dementia is often becoming irritable or often becoming aggressive. But it is very important to understand why the person is becoming aggressive, or why a person suffering from dementia is becoming irritable. Many a times, due to impairment in their brain functioning, due to impairment in their ability to speak, or ability to communicate, or ability to orient themselves in their surrounding, they are not able to convey a lot of times their whatever their needs are there. So the unmet needs will be displayed as some behavioral problems such as irritability or aggression. Sometimes they might be having a discomfort due to pain, okay, or sometimes they might be feeling hungry, they might be feeling cold, they might be feeling thirsty. So these needs they are not able to communicate as they used to communicate earlier before they were having dementia. So as they're not able to communicate, that gets manifested in terms of behavioral problems.
That it could mean something. The behavioral symptoms could actually mean something. Also, doctor, so we have heard a lot about Alzheimer's. Is Alzheimer's and dementia the same, or any difference is there?
So I told you that dementia is a general term to describe group of symptoms, or it's a disease. Okay, Alzheimer's disease or Alzheimer's dementia is one of the commonest type of dementia. So there are many other types of dementia as well, such as frontotemporal dementia, vascular dementia, Lewy body dementia. It will depend upon that dementia, that disease is arising because of what reason, or because of what risk factors. Okay, so based upon the etiology, the type of dementia changes. Alzheimer's is one of the type of dementia, and it is the most commonest type of dementia. More than 70% of patients who are suffering from dementia are having Alzheimer's disease.
So, doctor, A lot of people think that once a person is diagnosed with dementia, their life is over. There can be nothing done for them. So, can you just give us a little more information about that?
Yeah, many a times people think that once dementia is diagnosed, that there is end of the life or end of the joy, but it is not true. With early diagnosis and timely intervention, a lot can be done, such as early diagnosis helps in starting some medication and therapy and providing timely care and support to a person and a family member can improve the quality of life of a person and their caregivers to a lot extent.
Okay, so we can actually do something good for the people with dementia, and that is so great. Also, ma'am, can medication cure dementia?
See, there are many medications for dementia. Depending upon the type of dementia, depending upon the symptoms, we can start medicines to slow down the progress of dementia. There is no permanent cure for dementia so far. A lot of research has been going on, but there are a lot of medication presently to help with improving a lot of impairment in their cognitive abilities, and also medications are there to manage behavioral and psychological symptoms associated with dementia. So, with medication, a lot of symptoms can be managed, which helps in improving the quality of life, and also they help in slowing down the progression of the dementia.
Okay, ma'am. So, since you have explained us very elaborately how all ways and what all ways medicine can help with dementia patient, can you tell us what are the other possibilities that could also help them?
Yes, apart from medication, a person with dementia can be engaged into a lot of activities such as cognitive stimulation or cognitive remediation activities. These activities are designed to improve other cognitive performances of persons such as attention, concentration, improving their communicating abilities or decision making capacities. These activities can be done in different settings. They can be done in a home setting or they can be done at a daycare setting where a trained psychologist or trained therapist is sitting with the person and making a plan and making them do some activities. These activities have very promising results in improving cognitive functions and slowing down the progression of the dementia.
So it means that dementia is not just an end of life. With proper care and with proper information and support, we can do much better for them, right?
Definitely.
Yeah. So thank you so much, Dr. Saqib, for shedding us light on a lot of things that we thought that dementia